Jennifer Shepard, Integrative Manual Physical Therapist. Complicated patients, complicated health issues, multiple health issues. Those are some of my favorite patients and cases to work up and work through. I want to explain my process, how we work through all of this. And often by the time patients get to me, like, they are kind of frustrated, they feel bad. They're like, I've got so much, I'm so complicated, I'm a medical mystery, and they often feel guilty about everything that they bring to me with all of the different diagnoses that they've been labeled with and all of their multiple symptoms that they struggle with. And they've been to doctor upon doctor upon doctor upon doctor, where sometimes things show up on labs, sometimes it doesn't. And they really struggle with, they just want to feel better, but there's so much going on. And as we look at the whole person, we can't just chase one symptom and treat that. We have to step back, look at the whole person. We have to understand what's happened to this person, to this body, to this nervous system. What has happened to this person over a lifetime? Sometimes some of these things have their roots way back, like when they were born. The process of being born can cause compression forces. Sometimes that will affect nerves, nervous system, tensions on the brain. Sometimes there's childhood traumas, middle of life traumas. They can be physical traumas, falls, injuries, surgeries, impacts. Some of the times they're emotional, mental traumas. It doesn't matter how big or small it is. It's however the nervous system perceived a threat and then responded. And the brilliant thing about our bodies are they will always find a way to keep you safe, help you feel safe. They will always find a way to adapt, always find a way to keep you moving. So each thing that happens to your body has to pivot and find an adaptation to deal with that thing that your body had to deal with. So unfortunately, that thing that happened to your body doesn't go away or hasn't gone away. It's part of your tissues, whether it's emotional trauma or physical trauma. It's changed the structure of your tissues, or it's changed your nervous system's way of functioning. So those changes occur, they're part of you, and then your body is left to figure out how to now go forward with this and adapt to it. Often what happens is some people accumulate traumas, injuries, accidents, throw on top of genetic susceptibility. Some of us were given awesome health cards. Some of us were not given great cards by our genetic lines. What we eat, toxin exposures, all those come into play. So often what happens is the body gets to a point, it's like, I can no longer adapt very well. And then we start tipping into the disease process from a structure function perspective. And then we start getting into more symptoms. And often as we think about symptoms, I look at symptoms as your body's asking for help. And in our medical world, we are very good about trying to tell the body to shut up. You've got pain, take medication, make it go away. But whereas pain really is a message saying, hey, I need some help. And the hard thing is, it's not always easy to discern or identify, because that area of pain isn't always where we need to start. It's your body saying, hey, this area is having trouble, I need help. Same thing with other symptoms, GI issues, skin issues, so many of those things as they show up, they're signs for us that the body is struggling, but it's not always at that specific area or that specific system. And that's where traditional medical models tend to fail a lot of people, because they're only looking at the system where the problem is occurring. So as we take a step back and look at the whole person and we start to understand their whole history, we really understand the anatomy, the structures, the systems involved, we're able to prioritize, hey, where do we start? Do we need to start in your nervous system first? Is there tension on the brain that we need to get off your system? And then once we start to identify that priority list of the body, because the body's brilliant, it's got a priority list. And once we start to identify the most important areas where we start, other things start to fall into place and start to resolve a little easier. We still need to address them. Like, for example, someone's got gut issues, and then we've got skin issues, and we've got inflammatory issues. Yes, we need to address gut and gut health. But if there's deeper nuggets of chronic stress, a nervous system that is in a constant sympathetic state, that fight or flight, or there's old trauma that's been unresolved, no matter what we do to that gut is still going to struggle. You can supplement it all you want and eat really well, which is absolutely important. We have to do that. But we also have to figure out how we support that nervous system so it can come into a better place of ease and less reactiveness. So our job is to unpack the story of the complex patient, kind of put everything out on the table, and then, all right, what do we have here? Where do we need to start? How do we prioritize? And our work in the clinic as physical therapists is to address structural health primarily. We also address the concept of inflammation because we can't ignore that. We are amazing manual therapists and help patients restore structural health of not just their tissues and their joints, but also of organs, nerves, vessels, and help reintegrate them into the system. But the concept of inflammation, again, if people are still dealing with inflammation on a cellular level because of stress or environmental toxins, poor sleep, diet issues, food sensitivities, we need to address those pieces as well. And if we don't, then we refer out to the appropriate provider who can help our patients with supporting that inflammatory piece. But it's really exciting as I work with patients over time. This is not a quick fix. This is not a Band-Aid. This is really exquisite problem solving, planning, and we're testing as we go. How are we doing? And the beautiful thing is, as we start to support one system, then we can work on the next system. So that's where it is a process over time. But as the patient's body becomes less burdened, our job is to reduce the burden and the strain on the body, on the organism. And as we reduce that strain, the body is able to work better and get back to its, by nature, its ability to heal and recover and be more adaptable, have more wiggle room to adapt to the threats, because we live in a world full of threats, but it's able to adapt more to tolerate more things that come our way with regard to food challenges, stress, whatnot. We are just working to build more resilience in the system by unburdening the system. And a resilient system, a structurally and functionally healthy system, works so much better and is in such a better state of balance.